What's up guys, Pat here, checking in for another YouTube video today. And as you've seen in the thumbnail and the title, today is my surgery day recap. So currently, as I sit here today, I am one day post my hip arthroscopic surgery to repair my labral tear with femoral acetabular impingement. And today I'll be going through the surgery day in detail, as I'm sure a lot of you are watching this because you have questions about what that process entails, what exactly goes on. So I'm here to give you all the facts. Don't forget to comment if you have any questions. I'm more than happy to answer them for you. And then subscribe and like for more videos and following my recovery process. Diving right into it. So the day prior to your surgery, you will receive a phone call, most likely from the hospital, telling you the time that your surgery will be performed. And that is a tentative time because they do multiple surgeries in a day, and they obviously can be running behind or running ahead of schedule. So what my hospital told me was to be there 2 hours early, which I think is pretty standard for most hospitals. I highly recommend getting there very early, arranging a ride in advance, have a very bulletproof plan on how that day is going to go. This way you have no stress and other things to worry about, because I promise you, you're going to be a little bit nervous on that day. Depending on where you're having surgery relative to where you live, you may want to consider looking at hotel rates close to the hospital prior to your surgery, because they could very well call you the day before and tell you, hey, your surgery is going to be at 7 a.m. We need you there at 5 a.m. And if you're coming from a few hours away, sometimes it's just best to go the day prior so you have nothing to really worry about. In my case, I got my phone call around 6 o'clock the day before my surgery, letting me know that my surgery was scheduled for 3 p.m. and that I should get to the hospital at 1 p.m. I had a plan in place with my girlfriend that if it was going to be an early surgery, we were just going to travel and book a hotel room close to the hospital. With it being a later surgery, we decided not to do that and spend the night at home. The hospital will give you very specific instructions on what you need to do going into the surgery to prepare, and they're very, very strict on these things. So for example, I was told that I needed to take vitamin C, 1,000 milligrams for 2 weeks leading into the surgery. I was required to scrub with a specific body wash in the area that the surgery was going to take place for a week going into the surgery. Most importantly is the 24 hours before your surgery. They're going to tell you in most cases that you have to stop eating past midnight the night before, as well as fast regardless of the time of the surgery. So for example, my surgery was at 3 p.m. I wasn't able to eat at all that day going in, so make sure the day prior you have a big meal for dinner so that you're not super hungry throughout the day going into the surgery. I arrived at the hospital around 12 p.m. And just kind of sat in the outside area. It happened to be a nice day, which worked out well. And really, I'm one of those people where I just want to be there so that I don't have any stress going into things. I was definitely nervous, but I tried to listen to some music, spend some time outside, and just kind of relax my mind going into it. So around 1 o'clock, which was 2 hours prior to my surgery, they take you in for registration. So registration, you're going to sign off on a few things as soon as you enter the hospital, acknowledging what the procedure is, what the inherent risks are with the procedure, and just consenting to the fact that you're going to have this procedure done. From registration, they took me to the physical therapy area. I met with a therapist who I would later work with after the surgery, where they gave me a tutorial on how to use the crutches properly, what the best movements are, how to get upstairs and things of that nature, which was nice and comforting knowing that I had that information prior to waking up after the surgery. From the physical therapy area, I went directly to the holding area, which is essentially where you go prior to surgery to get completely prepared. At this point, I was assigned a room in the holding area and a nurse who came in and started going through her pre-checks prior to my surgery. This included an insertion of an IV into my left arm, and they immediately put me on fluids for just hydration. Then a physician's assistant came in to do a pre-surgical range of motion tests. So this for them was really to document what your range of motion is prior to the surgery, so that then later on they can evaluate how it's improved in the time post-surgery. So she did a few basic checks on my right hip. The nurse then returned to the room, and at that point they shave the surgical area. They also take all of your vitals and verify that you've adhered to all of the pre-surgical requirements, including fasting, not drinking anything but clear liquids, etc. The nurse actually told me that if you do admit to not meeting the fasting requirements, they do have to delay your surgery by law. So be very, very diligent in making sure that you meet all of those requirements correctly. At this point, you've changed into your hospital gown. You've been shaved in the area that the surgery is going to be performed in. They've taken your vitals. You've received an IV, and you're really just waiting in the bed. They notify you that the doctor and the anesthesiologists are going to be coming in for one last check. At this point, it's really just a waiting game, because from the time I arrived at the hospital to the time that all of that was completed, at this point it had only been like 40 minutes, so I still had about an hour and a half prior to when my surgery was scheduled to start. So I would recommend bringing maybe a book. My room had a TV, which was really nice, but there is a lot of downtime between when you're prepped for surgery and when you actually go in, which you can really get into your own head if you're not preoccupying yourself. The doctor then comes in and signs the part of your body in which they will be performing surgery. He or she will verify what the correct procedure is taking place, and you can ask at that point any last-minute questions that you might have. Then the anesthesiologist will come in and they will explain exactly what type of anesthesia you'll be receiving and what you can expect to have with your experience. Then is really just a waiting game. My surgery actually didn't start until 4 p.m., so I was in that holding area for almost 2.5 hours. So like I said, expect some downtime and have a game plan on how to preoccupy yourself so that you're not sitting there worrying the entire time. Finally, the nurse came in, told me it was my time, and at that point they'll ask you if you're comfortable walking to the operating room or if you want your bed wheeled to the operating room. I wasn't in pain to the extent that I needed to get wheeled over there, so you basically walk yourself with your IV next to you down the hall into the operating room. Almost immediately after walking into the operating room and lying down on the bed, the anesthesiologist was hooking up my IV to an orange substance, which after that, I don't remember anything. One of my biggest concerns going to the surgery is that I had no experience with anesthesia, specifically local anesthesia, which is essentially a spinal epidural tap that will numb the surgical area, as opposed to general anesthesia in which they have to put a breathing tube down your throat. Thankfully, they sedate you and you're asleep by the time that they're doing that spinal tap epidural injection. So as soon as you walk into the operating room, expect that you'll be asleep by the time that is taking place. After that, I don't really remember anything. These are some of the cooler pictures that the doctor actually provided me with. So in my surgery, they inserted 4 clamps into the labrum to repair it, which I was super excited about. They didn't have to remove any of the damaged pieces. They were able to repair it, and then they shaved the bone on the femur and in the socket to repair the impingement. Next thing I knew, I was waking up in a hospital bed. This was in a different area, which was the post-surgery holding area. My leg was already on the CPM, continuous passive motion machine, operating from 30 to 70 degrees to keep that leg moving even before I had even been woken up from surgery. In the post-operation holding area, you're assigned your own nurse, in which they will really be responsible for getting you up to speed to eventually get discharged to your rehab room. At this point, they'll give you whatever food that you want. Keep in mind that at this point it's 7 o'clock at night and you still haven't eaten anything. Most people weren't hungry. I actually established an appetite after a couple hours of sitting there. Also are administering pain medicine at this point. I was very comfortable and actually spent almost 6 or 7 hours in that post-operation holding area. The big test that nurses are continuously conducting on you will depend on where the surgical area is. For my instance, because it was a local anesthesia on the right leg, the last thing to come back was the ability to wiggle your toes. And what essentially they're doing is they're checking every 15 to 30 minutes on that ability coming back to you. You want to make sure that your nerves are functioning properly after the surgery, and they don't allow you to go to your room until you're able to just demonstrate this. For earlier surgeries, I'm assuming at this point, once you're able to wiggle the toes, you would be discharged. In my case, because of the delay in the time of the surgery, I was instructed that I would be staying overnight. I didn't gain the ability to wiggle my toes back until about 1 a.m. At this point, once you pass that test, they move you to the rehabilitation room. It's no different than any other hospital stay. You can expect a nurse to come in periodically to check on you, bring you meals, administer medication as needed. I didn't get much sleep though. The following morning, I was instructed that I would have a physical therapy appointment in the rehab wing of the hospital. The nurse instructed me that as long as everything went well in that physical therapy appointment, I would be discharged subsequent to that appointment. At the physical therapy appointment, they're just verifying that you're comfortable moving your leg in and out of a bed, making sure you're comfortable utilizing crutches, and making sure you're comfortable using the proper technique to go up and down stairs. And from there, I was discharged from the hospital. My parents picked me up and took me back home. As I sit here right now, I'm day 1 post-operation. I'm feeling pretty good. The nurses instructed me that day 2 and 3 post-operation would be the most grueling. So that wraps up today's video. Like I said, please leave a comment down below and let me know what questions you have that I can answer about that surgery day experience. Next up will be my video on 1 week post-recovery update. I'm excited to get started with physical therapy, excited to enlighten you guys on how I'm doing over the first couple days, and that video will be dropping in a few short days. Thanks, have a great day.